Nearly 6 months into the coronavirus, the pandemic continues to devastate thousands and thousands of families at an alarming rate. Latinos, like many other Americans, are still fighting for their lives and livelihoods. However, the fact is that COVID-19 has exacerbated long-standing social inequality, systemic racism, and anti-Blackness. For Latino families across the country, COVID-19 has had devastating health and economic consequences. According to the Center for Disease Control, Latinos make up 34% of the total COVID cases and nearly 20% of the deaths. Compounding the problem is that we're in a pandemic recession and the unemployment rate is up. Small businesses are shuttering, people are losing their jobs by the millions. The overall unemployment rate for the country is 10%, for Latinos is even higher at 13%. So now let's turn to the panelists for our first question. Why have Latinos been so disproportionately impacted by COVID-19? And what social conditions had led to this? So Sonia, let's start with you to give us a national perspective.
Yeah, thank you so much for having me. Very excited to engage with Aspen on this important topic. It's really a misunderstanding in terms of the impact of Latinos being something that Latinos can control. There's structural and systemic issues that have only worsened inequality. And so some research out of UCLA in particular has found Latinos are less likely to be covered in terms of health insurance than other demographics. That's true in California. They also are facing difficulties along with African American communities to shelter in place, meaning they live in high dense areas, they don't have access to a personal vehicle, green space, or a grocery store because of food deserts. Other issues are really economic. And we saw that COVID-19 and the stay-at-home orders had a disproportionate impact on Asian Americans and Latinos because they were so overly concentrated in the retail and service sectors. We now know in terms of the outrageous disparities that are occurring by race ethnicity, whereby African Americans, Latinos, Native Hawaiians, and Pacific Islanders are having disproportionate impacts in terms of infections and death rates. It's correlated to working conditions. The people that are safeguarding American life during this unprecedented pandemic are our frontline essential workers who are overwhelmingly of color, and many of them are Latinos. And they are going to work every day without the safety, protections, and institution building to know that they could stay home and be safe. And so those are some of the issues that we're confronting right now. And it's a failure of systems, and it's resulted in unnecessary loss of life.